About the size of your fist, the human heart is the most important muscle in the body. It can beat more than 100,000 times a day, pumping about 2,000 gallons of blood through a 60,000-mile network of vessels in the body. The human heart is made up of four major chambers: the right atrium, right ventricle, left atrium, and left ventricle. The right side of the heart receives blood that is low in oxygen from veins all over the body. It then pumps the blood through the pulmonary arteries into the lungs, where it will become reoxygenated. The left side of the heart receives this oxygen-rich blood from the lungs. Then it pumps the blood through the aorta back out to the rest of the body through a complex network of arteries, arterioles, and capillaries. While blood is circulating through the body, it delivers oxygen and nutrients to tissue through the capillaries, and at the same time picks up carbon dioxide and other waste material. The veins return the deoxygenated blood to the right atrium, and the cycle begins again. The heart has four valves. Each valve is like a one-way door that keeps the blood in the heart flowing in the same direction. The valves are made up of 2 or 3 small but strong flaps of tissue called leaflets. Leaflets open to allow blood to flow through the valve and close to prevent blood from flowing backward. The opening and closing of the valves is controlled by blood pressure changes within each heart chamber. The tricuspid valve is positioned in the heart's right side, between the right atrium and right ventricle. The pulmonic valve separates the right ventricle from the pulmonary artery. The mitral valve is positioned in the heart's left side, between the left atrium and the left ventricle. And the aortic valve separates the left ventricle from the aorta. As blood circulates through the heart, some of the blood flows into a set of much smaller blood vessels that provide blood directly to the heart. These arteries, called coronary arteries, surround or crown the heart. This separate circulatory system, called coronary circulation, keeps the heart nourished and oxygenated. The two main branches of the aorta that nourish the heart are the right and left main coronary arteries. Coronary artery disease, which occurs when there is a buildup of cholesterol plaque, affects the arteries of this circulatory system and causes a decrease in blood flow to the heart muscle, resulting in possible damage to the heart or a heart attack. The beating of the heart, which is its rhythm, is regulated by electrical impulses generated by your heart muscle. These impulses begin in the sinoatrial node and cause your heart to contract. Sometimes the sinoatrial node is also referred to as your heart's natural pacemaker, since it keeps the heart rate constant and consistent. The impulses then travel to the atrioventricular node, where the signal is checked and then sent through the ventricles, which causes them to contract. Your heart rate can change based upon external conditions such as diet, exercise, stress, or even hormonal factors.
Valves control the direction of the blood that flows through the heart. There are 4 valves, 2 regulating inflow, 2 regulating outflow. Notice how the valves snap shut when blood is pushed back against them. Real heart valves look and work like this: tricuspid valve, pulmonary valve, mitral or bicuspid valve, aortic valve.
Your heart is a pump. It's a muscular organ about the size of your fist and is located slightly left of center in your chest. Your heart is divided into the right and left side. The division protects oxygen-rich blood from mixing with oxygen-poor blood. Together, your heart and blood vessels comprise your cardiovascular system, which circulates blood and oxygen around your body. In fact, your heart pumps about 5 quarts of blood every minute, and it beats about 100,000 times in one day. That's about 35 million times in a year. Oxygen-poor blood, blue blood, returns to the heart after circulating through your body. The right side of the heart, composed of the right atrium and ventricle, collects and pumps the blood to the lungs through the pulmonary arteries. The lungs refresh the blood with a new supply of oxygen, making it turn red. Oxygen-rich blood, red blood, then enters the left side of the heart, composed of the left atrium and ventricle, and is pumped through the aorta to the body to supply tissues with oxygen. 4 valves within your heart keep your blood moving the right way. The tricuspid, mitral, pulmonary, and aortic valves work like gates on a fence. They open only one way and only when pushed on. Each valve opens and closes once per heartbeat, or about once every second. A beating heart contracts and relaxes. Contraction is called systole, and relaxing is called diastole. During systole, your ventricles contract, forcing blood into those going to your lungs and body, much like ketchup being forced out of a squeeze bottle. The right ventricle contracts a little bit before the left ventricle does. Your ventricles then relax during diastole and are filled with blood coming from the upper chambers, the left and right atria. Then the cycle starts over again. Your heart is nourished by blood too. Blood vessels called coronary arteries extend over the surface of your heart and branch into smaller capillaries. Here you can see just the network of blood vessels that feed your heart with oxygen-rich blood. Your heart also has electrical wiring, which keeps it beating. Electrical impulses begin high in the right atrium and travel through specialized pathways to the ventricles, delivering the signal to pump. The conduction system keeps your heart beating in a coordinated and normal rhythm, which in turn keeps blood circulating. The continuous exchange of oxygen-rich blood with oxygen-poor blood is what keeps you alive.
This animation sequence will provide an overview of normal cardiac structure and physiology, along with a review of the process of excitation-contraction coupling in the heart. The myocardium is comprised of cardiac myocyte and non-myocyte cells. Cardiac myocytes make up approximately 70% of the mass of the heart and are enmeshed in a collagen network that acts as a supporting framework. Blood is supplied to individual cardiac myocytes through capillaries that are in close proximity to them. Cardiac myocytes are comprised of actin and myosin myofilaments, whose organization gives rise to the characteristic striated appearance of cardiac muscle. There are 2 prominent organelles within cardiac myocytes: the mitochondria, which produce energy, and the sarcoplasmic reticulum, which regulates calcium handling in the cell. Cardiac contraction is initiated when extracellular calcium moves into the cell across the voltage-dependent L-type calcium channel. The calcium that enters the cell triggers calcium release from the ryanodine receptor through a process known as calcium-triggered calcium release. Calcium that is released from the sarcoplasmic reticulum binds to the actin-thin filaments, thereby initiating contraction of the sarcomeres. At the end of the contraction sequence, calcium comes off of the myofilaments and is actively transported back into the sarcoplasmic reticulum by the calcium pump in its membrane. Calcium is also transported out of the cell into the extracellular space by a membrane-bound pump sodium-calcium exchanger, which is not shown here. Cardiac contraction is brought about by interactions between the actin-thin filament, shown in yellow and purple, and the myosin cross bridges that project from the thick filament, shown in red. In relaxed cardiac muscle, the conformation of troponin and tropomyosin prevents actin from interacting with the myosin cross bridges. As a result, actin is unable to interact with the myosin cross bridges containing bound ATP. In activated cardiac muscle, calcium binds to troponin C, which then shifts troponin complexes and tropomyosin to an active conformation that enables actin to interact with the myosin cross bridges. Myosin ATPase on the myosin heads then hydrolyzes ATP, thus providing the requisite energy for the myosin cross bridge to interact with the thin filaments and pull the thin filaments towards the center of the sarcomere in a ratchet-like fashion. In this sequence of the normal heart, we have reviewed the process of excitation-contraction coupling. As will be discussed subsequently, this process of excitation-contraction coupling becomes dysregulated in cardiac hypertrophy and cardiac failure.